Hi there, I'm Jay Moore, Chief Clinical Officer of Paytient, and I'm here in sunny Florida to talk with Chris Labrecque from the Insurance Office of America. Chris is the president of the Employee Benefits Division here at IOA, and we were really intrigued by his approach to employee benefits. He advocates an approach that allows employee engagement to improve, and his philosophy is that by improving employee engagement, a company actually increases its own performance and reduces its risk. And that risk reduction might even help to decrease healthcare benefit expense as well. Sit back and relax and take a listen as I talk with Chris Labrecque from IOA. We can go?
Yes. We can go.
Well, here we are.
Here we are. Johnny Carson couch.
Yeah, that's right. Everybody, give it up. Welcome to Chris Labrecque. All right, well, Chris, I am really excited to be here talking with you today. I think we can just start off with a little bit of introductory information, if that's all right, and what you do here at IOA.
Sure. So my name is Christopher Labrecque. I serve as the president of the Employee Benefits Group here at the Insurance Office of America. Our home office is here in Orlando. It has been for over 30 years.
Great. Can you tell me a little bit about how you came to work here? So just tell me about your path. How does one go from wherever you started to where you are now? Because I think it's a really interesting story.
It is. Actually, in our business, I like to say, unless you have family in our business, no one goes looking for the insurance business. You kind of fall into it. And I was no different under those circumstances. I was working in construction as a manager and got in a bad car accident, hurt my back, and my ability to function in that role was diminished considerably. And a friend of mine who worked for MetLife said, you should try that. So I did. Went to work for MetLife for about 18 months and then transferred to a small local agency that I ended up being a partner in, and we sold that agency in 2010 to a friendly competitor, and then got repurchased by Insurance Office of America on July 1st of 2010, and I've been here ever since.
And since you've been here, your career has really skyrocketed. So tell me a little bit about that. How did that go?
So I was at the time in New Jersey where my office was and our business was, even though we were IOA, my role was dual. I was a property and casualty agent as well as a benefits agent. And in IOA, we really try to drive people towards a specialty in one area or the other. So I chose benefits. And John Rittenauer, who was our chairman and CEO at the time and one of our founders, had said, why don't you help us grow our initiative here in the Northeast? So I did, and I really enjoyed it. I loved the autonomy that you get at IOA as a practicing partner. And I guess it was in May of 2014, I was asked to be the managing partner at the time of the department, which required me uprooting my family and moving from New Jersey to Orlando, which was a little bit of a culture shock, but a good one. As I said, and I say all the time, I traded my brown and grays for blue and green, which, wearing shorts in January is a really great thing. So it's been an absolute blessing being here at IOA and working with such a great team.
Awesome. You said that you had to make that choice between benefits versus property and casualty. What was it that drew you into the benefits world as opposed to the P&C world?
I think the need, honestly. I mean, benefits, the centerpiece of benefits right now, and has always been this way in my career, is health plans. And the challenges that are associated with that in population health management, just navigating the path for the members that we serve. It just seemed like a bigger challenge to me and a more dynamic opportunity. I just like that. Also, I realized over time that those two things, property and casualty and benefits, are really intertwined.
Really?
In many ways.
Tell me how.
So, well, if you think about it, the driver of risk for most employers often is kind of born out of their people. It's not the CEO who backs over somebody with a forklift. It's the disengaged employee who may be unhealthy, may be financially stressed, just might be actively disengaged. Gallup has done studies since 2000 on employee engagement in the American workforce. And if my numbers are right, I think in 2019, prior to the pandemic, we had the highest score of employee engagement in the U.S. that we had ever had at 34%, which is fairly dismal if you ask me.
34%.
34%. We're engaged. So, and I think the numbers are between 15 and 18% are actively disengaged. So they're actually working against their employer. that's extraordinarily risky.
We talk a lot about engagement and how important that is for employers and what that really means and how that can affect the culture of the company and really the results of the company. Do you have a couple of examples of times, you don't have to name names of course, but times where you can really contrast a company that's really highly engaged or their employees are highly engaged versus one that's not, and what you see in terms of the results?
So yeah, and we've all experienced this, right? You think about your career and the different places you've worked and times where you felt that you had autonomy, that you were given mastery, that you had purpose, that you were connected to something bigger than yourself. What was your performance like then? And then think about a time where you weren't, where you were micromanaged, asked about your TPS reports by multitude of bosses. We've all seen the movie Office Space, right?
Sure. I have a red stapler, so
a swing line, of course.
Yeah, right.
Of course, but the thing is, the performance at the employee level is not only better, but it actually reduces risk overall. We've all experienced this. I mean, you walk into a coffee shop and you sense that irreverent camaraderie, which is a sign of trust, behind the counter, where they're kind of teasing each other a little bit. Well, the coffee there tends to taste a little better.
You're right.
Right?
Yeah.
And it's also, it's just a better experience overall for the client. But at the same time, you're actually reducing risk overall. And you can think about that in blue collar, gray collar, white collar industries. It happens across the board.
Tell me how you think that risk changes with engagement.
So let's talk about disengagement, right? That risk changes extraordinarily. Somebody who is stressed financially, gets themselves in a upside down in their debt to pay ratio, whether their pay is from a benchmark standpoint fair, in the industry, it doesn't really matter. Once they get into that position, they tend to be disgruntled, they tend to be upset, they're more stressed, they don't do the right things with respect to their own health, and it has an effect on that overall. It also has an effect on their performance at work, and their performance at work can drive risk considerably. So somebody who's disengaged or actively disengaged driving a forklift is a danger to the people around them.
An actual danger.
An actual danger, absolutely, right. Yeah. So, and there's other ways that property and casualty and benefits are intertwined, and the easiest, simplest way to look at it, and the thing that most people connect to, is workers' compensation and general health care. So occupational health and general health. If you look at it from a whole health standpoint, these things do start to intertwine with one another, because it's been known that somebody who has two morbidities, so maybe high blood pressure and diabetes, or obesity and diabetes, if they go out on work on a workers' comp claim, they're out 6 times longer than someone who has one comorbidity. So you can see where improving the health of a population, which is what we do in benefits at IOA, can have a drastic impact on the implications of claim from a property and casualty standpoint. But it's really the undercurrent of employee engagement that drives this, I think, even more. It's not what we do. What we do is help our employers by providing the right coverage at the right time with the terms and conditions that they need for a fair price. That's something that we do very well. But there's more to it here, right? When you start to think about employee engagement, then you're thinking about what's the proximate cause of claim. Because oftentimes you can put the pandemic-free services in place and proper lifting techniques, but if you have disengaged employees or unhealthy employees who are stressed for one reason or another, it doesn't matter. Things are going to happen, and things are going to happen because they're not really connected. They're stressed about other things. They're thinking about other things. If you can implicate that, if you can have an impact on that, then all the other things that you do are greatly amplified, which is pandemic-free services, proper lifting techniques, protections that an organization should have. I believe that the human capital aspect of this hasn't been exploited the way it could be by resequencing a lot of the things that we already do around that employee engagement idea. And I think it has drastic impact on risk.
So the employee engagement, we've both worked at companies where employee engagement is a concern for the company that we're working for. And we often see things like, the company might take you out to a baseball game or put up signs that talk about how great a job you're doing. You really believe that the way that a company structures their benefits can change employee engagement and take people from that disengaged category to the engaged category. Is that right?
Yeah, I believe so, yes. And I believe it's beyond benefits. I think there's more to it here. When we talk about benefits, predominantly what we're talking about is your health plan, your dental plan, your vision plan, your life plan, long-term disability, short-term disability, 401ks, and that thing. But I think what's happening now in the market, where as we watch the social construct between employer and employee change, and since the pandemic started, it's revealed a lot of challenges that were hidden in plain sight, I like to say, and really accelerated the shift from the power of the employer to the power of the employee. We're seeing it in the Great Resignation. We're seeing just people leaving their jobs in droves in the last 6 months, things that we've never seen before. So I think that social construct is starting to change. So when we talk about benefits, we really need to start broadening that conversation. You know, the benefit of having autonomy, the benefit of being of having status, the benefit of having freedom and flexibility to help craft a lot of what you do in accord and in concert with your employer. That's a benefit. That's something, like I said, that amplifies what we do. Healthcare benefits overall are very, very important because that's part of the engagement process. But it goes beyond that. You know, we look at really 5 main areas. We look at health for the employee. We look at their financial situation. We look at their social standing at work. We look at their professional atmosphere at work. What's that like? And then safety. And safety's, again, pandemic-free services and proper lifting techniques, but really it's psychological safety in the broadest sense of the term. Think Maslow's hierarchy of needs gets brought into the workforce where it wasn't before, right? We use management techniques that we've used since the late 1800s. That's a technology that we had, and mostly it was used in manufacturing plants, and it was basically to make sure that people were doing what they were supposed to be doing along the line all the time, right? We've been
that kind of supervisory top-down, I have to make sure people are doing the right thing. If I don't watch them all the time, then they're going to wander off and do something else.
Yeah,
right?
The expression "my manager is great" is almost an oxymoron, right? Because if you're given autonomy, mastery, and purpose, you know the things you're supposed to do at work, and you're given the resources and tools to make it happen, go do it.
Right.
And it's that sort of freedom where people reveal their best professional self. When they do that, they create the greatest output, they create the highest net promoter scores for the employer, they reduce risk, they reduce cost. It has substantial implications for that employer throughout.
Now let's talk about, you mentioned those 5 areas.
Mm-hmm.
So you know, the first one was health. Mm-hmm. So tell me about, let's explore each of those in depth.
Sure.
Starting with health.
Okay.
So tell me about how you see health as, I mean, it's almost obvious, I guess, but how do you see health as a benefit, and how do you see the employer affecting the employee's health?
So it really isn't obvious, and I respect what you're saying, but I think when we talk about that, we have to recognize that everybody's in a different place in their journey. And we have to meet people where they are in that journey. So health, we think of, you know, somebody standing there with their hands on their hips who's got, you know, 7% body fat
right.
and goes to the gym every single day. Well,
right.
Health looks like a lot of different things, and for everyone, the path to health is different, and it's very unique. You know, so understanding where they are, we would like to understand and emanate the highest possible feelings around health. I know where I am in my healthcare journey. I know where I need to go next with respect to my health to maintain my health or improve it. I have the tools and resources that are personal, relevant, and accessible and not too costly to be able to accomplish that. My employer provides those things because they're actually thinking about my health and my general welfare overall. So those are the kind of, that we want to emanate those feelings in the prototypical employee of an IOA client at the highest possible level. So we need to meet those folks where they are, and then aggregately meet that employer where they are. So we work both at the employee end user patient level, and we work at the administrative level, because the HR person, typically that's the person that we're dealing with, is responsible for the population health, is responsible for a lot of different things. We can talk about some of the challenges that they face that we can help with. But around health, we want to find out where they are in their journey and then continue to put relevant tools and resources in front of them that they see has value that they can access very easily. I don't think historically the industry has done the best job at that. I think there's a lot of opportunity there for us, for sure.
And the way I hear you talking about health, I really think of it as more than just physical health. You're talking about mental health and just the overall well-being of a person, which can really have so many different factors. I have a daughter, and she's always asking me, hey, Dad, is this thing healthy? You know, can I eat this food? Is this a healthy food? And I think the answer to that is, well, I mean, it depends. You know, how does it affect your physical well-being? How does it make you feel? How much of it are you eating? You know, so I really respect what you're saying about health means something different to each person depending on where they are, what their goals are, what things they'd like to accomplish, and just what's happening in the rest of their lives.
Yeah, and I appreciate what you're saying, because it is a much broader conversation, and we've recognized this even more so during the pandemic, where mental health, mental well-being is a big part of, and it's a driver of actual physical health, right? I mean, if you're depressed and not feeling well, you feel lonely, or you're detached, or you're just scared, your health tends to degrade over time, right? So it's very important to look at this, and we make, as individuals, we make over 1,000 healthcare decisions a day. Eat this, don't eat that, don't eat this, walk, stand, run, all these different things that we do every single day. And sometimes it's just in the 6 inches of real estate between our ears where we're making these decisions, and the health there, right? So do I feel good about myself? Am I empowered? Do I feel like I drive value for my family and value for my coworkers? All of these things very much are related to one another. John Muir, the naturalist, had a great expression: if you tug on one part of nature, the rest of nature moves to varying degrees. And I believe when we look at commercial risk, and when we look at health, the professional life of an individual, the social, the financial, and the safety overall of them, we have to recognize that as we tug on one or touch on one, we're touching on all the other to some degree at the individual level. So it's really important. When we talk about health, we want to look at that holistically, not just mental well-being or physical health and the tools and resources that we think of traditionally, but it's bigger than that. Does a person work for an organization that makes them feel empowered, that they're proud of, right? The New York Yankees win the World Series, and the next day everybody's got pinstripes on, right? That's called burging, basking in the reflecting glow. Do people feel that way about their employer? Do they feel connected to something bigger than themselves? So you move from health to the professional, right? And you look at what are the feelings you want to emanate there. Well, one, I really like where I work because I have a great relationship with my direct report. I know where I reside in the company's ecosystem, and I know that the value that what I do brings to the end user. Whether you're the person that works in the mailroom or you're the CEO, you need to be connected to that. You need to, and it's important, right? Because you want to be valued for that. You want to be a part of something. They say, with respect to engagement, that's the factory default setting for all of us. I think it was Daniel Pink that said that. Find me a 4-year-old, or it may have been Dan Coyle. Find me a 4-year-old who's disengaged, and I'll find you someone who's not healthy physically, right? Who's got something wrong with them, right? It's our factory default setting, and we learn to become disengaged over time based on a multitude of different things that occur. So professionally speaking, do I feel safe with my direct report? Does my direct report see my progression within the organization together with me? Right? I want to move up in the organization. Does my direct report see that and support that with me? Are they helping me to get there? Right now, younger folks who go to work, from what I've heard and read, younger folks coming into the working system want to know what that salmon ladder of success looks like over time. It's because they want to start to earn their way to the next level. If they can't see that, they're going to be looking over the fence at another employer and possibly moving on. Again, the John Muir expression, tugging on one aspect of something can have an effect on another. If my job is to provide benefits, which in large part is population health management, and I have a high turnover rate, I'm not going to be very successful in managing the health of folks who are only staying with my employer for 6 months, right? So that progression over time will hold employees longer, which means the resources that they invest in to manage the health of the population become more valuable, because you've actually got somebody in the system for a longer period of time.
So let me ask you a question, which I don't know, this might be controversial, I'm not sure, but I think that sometimes some people who are listening to this might be thinking to themselves, well, that's great, but that feels paternalistic to me, for my employer to be the one that's responsible or managing my health. How would you respond to that?
Well, so what's happening right now in the marketplace, in that social construct between employer and employee, we need to be more paternal. I mean, I think as employers, we need to be fulfilling our team members. There's a lot of different reasons to do that. One is the right thing to do, honestly. But the other part of it is it actually drives commercial value. It drives shareholder value. That's the residue of all those other things you do really well. Teams that are highly engaged care about each other. How they care about each other is directly related to how the clients see that company. And we've all experienced this, like we talked about the coffee shop, right? And you've seen it in sports teams where teams gel and come together, and you watch them play, and they're almost playing, they're like kids. They're playing for the fun of it, for the game of it, and the enjoyment of it, not for the paycheck so much. You don't get that sense, right? That's a highly engaged team. That has substantial value later on down the road. So should we be paternalistic? Shouldn't we be paternalistic? I think we have an obligation to look at business differently. And our job at IOA, Insurance Office of America, is to reduce, transfer, and mitigate risk all the time. I firmly believe that engaging employees into that corporate culture in a way that makes sense for them to help drive value actually reduces risk and amplifies that. So should we be paternalistic? I think you're going to see, and you're already starting to see, seeds of this in some of the most successful companies. They're thinking Maslow's hierarchy of needs at work. They're trying to fulfill folks and put them in a position to reveal their best professional self.
I think that, over time it feels that it's becoming more of a relationship also, that I work with a company, I don't necessarily work for a company, that when you have a really high functioning team that you're working together, we're helping each other out. So my employer, I don't really think of my employer paternalistically. I think of my employer as a place where I'm there for a reason. I'm helping that company succeed. They're helping me succeed and grow. We are working together to build something that's bigger than both of us in a lot of ways. What do you think of that?
I think you're spot on. I think that makes perfect sense. I mean, think of it this way. Do you refer to the person you report to as your boss, or do you refer to them as your leader? And what's the difference intellectually? What's the difference emotionally for you when you think of those two words?
What is the difference?
Well, a leader is somebody who uses influence versus power. Influencing people to highest and best use to best practices is so much more effective than just simply saying, go do it because I said so. Sometimes you have to say, go do it because I said so, because you're not getting that connection. But the hard work of a leader, especially a servant leader, is when they can actually influence their group to best practices. And that is more sustainable. It is more successful over time. You've seen some of the greatest leaders out there. They don't lead with authority. They don't lead with power. They lead with leadership, with influence and examples. And they're very authentic and transparent in many ways. And that connects people, that builds trust. You get an army of volunteers is a very powerful army.
We've talked a little bit about some of these elements and the way that, as you're thinking of them, it's not necessarily that there's one that starts and one that ends. They sort of blend into one another. So tell me a little bit more about that.
So when we talk about meeting people where they are, we have to meet organizations where they are as well, right? So the organization is even more dynamic than the individual, so to speak. And so if you're going to approach this authentically with an employer, right, we need to meet them where they are. And as a result, you have to recognize that there's no introduction and closing and everything in between. It's not a static vertical PowerPoint, right? And oftentimes a lot of folks they want to tell their story. Mm-hmm. I think when we talk about this, we need to inverse it. We need to have the conversation about the employer's story. And where it starts and where it ends is going to be driven and co-created in real time. So think of this as a three-dimensional ecosystem. I don't know where we're going to start when I walk into the room with a potential client. We just begin a conversation about business, and we start to go down this path and learn more about them. And as we do, we explore the elements in conversation unique to that specific organization. It changes from I'm talking about me to I'm talking about us. And I'm talking about you, and I need to understand you on a more deeper level and recognize as I'm doing this that I might be opening their eyes to looking at things slightly differently. I like to say that industry disruption doesn't always happen with a new piece of technology or a new device. Oftentimes it happens just by taking the assets you have and resequencing them in a different order that's more impactful and has a really client-centric aspect to it. So all of the elements are there. Each employer that we talk to is in a different journey in each one, mm-hmm. and respecting that as we explore this with them and co-create solutions and results is, I think, really important to the process.
So we talked about health, and then you started talking a bit about
the professional
component. So tell me more about the professional aspect.
So yeah, I think it's important to when we're meeting those end users where they are, the employee. In my business we call them employee, end user, patient, right? Because they really satisfy different roles depending on what we're trying to accomplish for them. meeting them where they are from a professional aspect is, one of the most important things is making sure that they have a solid relationship with their direct report, right? Nobody fires the company that they were working for. They fire typically the person that they were reporting to directly. If they have a very strong relationship there, notwithstanding the company relationship the employee has with the organization, if they have a strong relationship with their direct report, they tend to stay. And they tend to be more loyal. Really, really important. But the other part of this is helping that employee recognize where they are in the ecosystem of what the organization does and the value that brings. I think it's really important, if you're talking about engagement and risk reduction through engagement, that you provide people with that constant reinforcement of the value of the work they do, right? Connie in the mailroom doesn't show up. She doesn't open up checks. And all of a sudden, those checks don't get opened. Chris, as president of the department, doesn't show up because he plays golf all day. What are the implications, right? There's an immediate implication if Connie doesn't show up and doesn't open those checks and make sure accounting gets the checks and that mail gets routed properly. Everyone has value that affects the end user. Recognizing that and making sure that our employees see that and hear it is extraordinarily important to make sure that they feel part of that. The other part is making them feel part of something that's bigger than themselves.
Right.
Connecting them, and that's really what that is, right? So it's seeing the salmon ladder of success in the organization, and sometimes there's lateral moves, and sometimes there's just moves up. The military does this really well. The Army is E1, E2, E3. It's very definable, really, really rigid and structured, which is a good thing because they need to be. In other organizations, what that looks like for any given organization is not always easy to lay out for folks, but I think it's a worthy process. So seeing that future growth, but recognizing where the organization is going as you are moving up in the organization or into more fulfillment professionally in the organization is extraordinarily important, because you want people to be connected to something that's bigger than themselves.
Yeah, man,
it drives engagement.
I really feel that. I've worked at lots of organizations where you have a hierarchical approach, and I've worked at organizations where it's a little less hierarchical, but just having that sense of belonging and connectedness and progression over time, that the work that I'm doing is being seen and recognized, and that I'm being rewarded in the way that's meaningful for me. So for me, being rewarded is to be given more responsibility, to be given another project, something that I can work on that can help the company improve and get better over time. I think that's really important, and I agree with you. It is equally important as the physical health of a person, is that professional health and professional development of the person. Those things are both really important to make sure people do stay engaged.
And so, again, back to the John Muir quote, there's a value proposition to doing that, right? If you do the hard work, the heavy lifting that goes along with helping people understand what that looks like for themselves, that actually has a reverse value proposition back to health. They tend to be healthier because they're not as stressed about what their future is going to look like at work. There's a future sense of belonging, which has again, you're going back to Maslow's hierarchy of needs. That has an extraordinary impact. They can see themselves in that future. That reduces stress dramatically and actually improves health. So you have this value proposition of what you do in health and a value proposition of how you approach your leadership of your team members, call it professional, and actually there's an exponent value proposition. You're talking about 1 + 1 starts to equal 2.5 or 3 versus 2, right? So each thing has implications on the other. And so if you're trying to improve health, but you're not addressing the stress levels at work because it's super rigid and just not fulfilling, and there's a lot of challenges there, you're only going to improve health so much, right? And also you have turnover. So.
This is so refreshing to think about how so often we see companies that come in and they're thinking about their benefit expense, they're looking at their healthcare expense overall, and what they're focused on is the network that they're putting together of providers, or the rates that can be negotiated with those providers, or the deductible for the health plan. But what you're saying is that there's so much more to it than that. You have to really look at the overall person, and if you're not helping them develop and be successful professionally, then you will see an increase in health expense because they are stressed out and their physical and mental health is being affected by their professional well-being, and vice versa.
And that's exactly how this works, right? So recognizing that, if you start to have these conversations with employers and you recognize this, it changes the conversation, right? Deductibles, co-insurance, networks, access to care, centers of excellence. These are all really important. I'm not diminishing that. I'm simply saying amplify it by inviting other aspects into this conversation around what really drives health. And so I think as we continue to explore this, and we continue to explore it with employers just in conversation alone, it's like you can't unsee it, right? It's like, okay, well now I know what the proximate cause is. My property and casualty partners talk about proximate cause. What that means is what was the driver of the claim, right? You have a flood in your house. Was it a burst pipe? Was it an open window? Was it a hole in your roof? That's the proximate cause of claim. If I have healthcare issues for my employer, what's driving that? Is it because is it because the professional atmosphere drives stress so high and the team is so overworked that they just can't get healthy, or that's impeding their ability to improve on their health? I got to address that. I can't unsee it at that point, right?
So Chris, we've talked about how health can be affected by someone's professional environment and vice versa, and these are two really important elements to improve engagement and thereby reduce risk for the company. Mm-hmm. What about finances? That is, the financial health and well-being of a person is another important element, yes?
Yeah, for sure. So studies have come out, and I think a lot of what we're seeing today versus 2 years ago is just amplified, right? So 43% of the American workforce, their number one stressor is their finances, right? So, and oftentimes it doesn't mean that they're not getting paid enough. So I want to kind of take that off the table. It might for a different organization that the benchmark pay rates may not be where they need to be. And that's not a problem depending on the situation and the organization. Oftentimes it's debt to pay ratio, right? We just came out of Christmas. We just came out of the holiday season. Mm-hmm. Single mom goes a little too far because she wants to make sure her kids get what they wanted for Christmas. She was trying to make up for certain things. She earns $37,000 a year. She spends $3,000 on Christmas. High credit, numbers. She gets a little underwater financially, and she becomes stressed. That actually has a physical effect, right? It has a mental health effect, and then it has a physical effect. How's that going to manifest itself? We're not so sure. She also might become a little disgruntled that she's not getting paid enough or got passed over for a certain raise, but she might be paid fairly, right? But it's a debt to pay ratio thing. So if you can address that and help that individual, as well as countless others, with knee-to-knee financial counseling, what are the implications on actual health? Well, if finance, or the lack of finance, or being upside down financially, is a driver in health, I've got to address that, right? Again, I have to recognize that the two implicate one another, and then if I can do that, it makes sense. The other part of this is, as you manage debt to pay ratios at the individual level, you reduce turnover. And if you reduce turnover, you have people in the health continuum for a longer period of time, so your ability to improve the health of that population is amplified, right? So I have to now introduce knee-to-knee financial counseling so people are empowered to get their debt-to-pay ratios appropriate. That reduces stress. If 43% of the American workforce blame financial situations for their number one stressor, I got to address that. I got to recognize that the stress is going to drive physical health. I think it was 25 to 30%, PricewaterhouseCoopers study of the American workforce said that they directly blame their physical health on their financial well-being. Mm-hmm. Again, there's lots of studies on this stuff. We've seen it. But if my job is to drive healthcare costs down for that employer, to control the healthcare costs and improve the health of that population, I've got to introduce solutions inside my silo, which is health, but I need to understand the implications of what's the professional environment there? What is the financial situation for those end users? Are they feeling right-sized in their debt-to-pay ratios? And if they're not, how can we help them get there?
To what extent do you see health as being the driver of financial well-being?
So I would reverse that. I would say financial well-being can be the driver of health. Oftentimes, if you manage the debt-to-pay ratios, people are less stressed. The behavior changes. And as a result, overall, if the PricewaterhouseCoopers study is accurate, and I believe it is, you're seeing directly that people are really stressed financially, and as a result of that, then they become physically stressed.
What are the sources of some of that financial stress that you're seeing?
High credit, college debt these days. I mean, it's extraordinary how far people are willing to go into debt for education. I'm not saying it's a bad thing. I think there's two things you should always spend a lot of money on: education and nutrition and food. Two things we should spend more on that we probably don't. But managing that after the fact, for folks coming out of college who are just getting into the workforce, they're starting with a massive debt load, and that stresses them out. Helping them manage that, helping them reduce that, putting them on a path that puts them in a position to be empowered financially, at least under control, and giving them the tools and resources, much like we do in health overall, right? The right deductibles, right information to make healthcare decisions in the moment. Same thing with financial. Be able to manage surprises as they come up. Oftentimes some people put a pretty high deductible on their auto insurance, and 2 months later get in a car accident. All of a sudden that deductible's theirs. Well, we want them to be prepared to handle that. And if you read some of the studies that come out about the workforce in the United States, most people don't have 6 months of income to fall back on. Right? Despite the fact that up until the pandemic, we had a very low unemployment rate. Things were humming along economically. Things were going well. People were still living paycheck to paycheck, day to day. And I just don't think we've done a great job as a society in helping them manage that, teaching them that. I think it should start early on, teaching finance, because it will have implications throughout the rest of an individual's world that can be extraordinary.
So what about high deductible health plans? Do you see that as a potential stressor as well? If a person, you mentioned car insurance and having a high deductible on your car insurance. A lot of people these days have a high deductible on their health insurance. Is that also a point of stress for people?
It can be. It depends on how it's introduced, right? I mean, there are a couple things. The way I envision high deductible health plans when they came out, they were really supposed to serve a couple different purposes. One is to reduce cost of healthcare, right? So, and it automatically does, but all you're doing is shifting the burden to the end user from the administrative level, right? So, and that may make sense because what it was meant to do is provide folks with a deeper understanding of where to go for their care. Think of an MRI. You go into a hospital for an MRI, you're looking anywhere between $2,000 and $3,000. If you go to a standalone facility to get your MRI, it might be $400. Well, if those are your dollars to spend, you're typically going to be a little more active in where you get your care. So I think high deductible health plans, when they're introduced to the right folks, they make sense, right? My family is fairly healthy. We're fortunate and blessed in many ways to be healthy. We have a high deductible plan, and so because our utilization patterns are very low, so it doesn't stress me out. And as a result of that high deductible plan, over time I've been disciplined enough to set aside the dollars to offset my deductible and my co-insurance, my maximum out-of-pocket expense on a tax-favored basis in a plan like that, to make sure that that's set aside for me and for my family if and when I need it. So it's not a stressor for me, but I'm a low utilizer. To simply make the decision as an employer to go from a PPO plan with a copay of low copay for office visits and prescription drugs to a high deductible $5,000 per individual plan, yes, you're going to save money, but you've shifted that burden now to your employees, and in many ways they may be very stressed out by that because they weren't really prepared for it. It was done as a knee-jerk reaction to a high increase in healthcare. Now, you got to manage your shop, right? So as an employer, sometimes the wolf is at the door, and that's the move you have to make.
Right.
There's just recognizing that there's going to be implications and damage as a result. Some people may not access care that they should access in that high deductible program.
Right.
As a result, when they finally do access care, the situation has manifested itself considerably, and the cost of that claim goes up dramatically.
Yeah.
There's implications.
I can definitely validate that because, I'm a doctor, and certainly we can see that when people put off health care because they're worried about how they can pay for it, a small problem becomes a big problem. And it's harder and harder to take care of. And of course, that whole time, to get back to your earlier points about the way that all of these things are linked together, the John Muir quote about tugging one thing and other things moving, we certainly can see that when someone puts off a healthcare problem, and that starts to affect the way that they're working, starts to affect their professional relationships, causes them to disengage from work, and that can become a risk for the employer.
It certainly can, and we saw it in the pandemic, right? I mean, in March of 2020, people were not going to the doctor unless they absolutely needed to, right? They weren't going into hospital systems unless they absolutely needed to. We were all kind of in lockdown. And as people come back into the system, many of them who were diabetic, had other chronic conditions that were not addressed. They came back into the system. It wasn't $1 of claim, it was $1.50 or $1.75 of claim that was coming back into the system as a result. So you can see from a population health management standpoint, the implications of that if you hold people out of care that they should be normally accessing. And if it's just as a result because they had a high deductible program, but they weren't fully understanding what they were getting themselves into, they were just chasing the lower rate, that can have longer term implications later on down the road.
Yeah, and I have to just take a moment to give a plug to my own company, to Paytient, because the high deductible health plans that we see, the use of Paytient can really provide a safety net for people and allow them to have a way to pay for some of that unexpected expense when they're on that high deductible plan.
And that's really important, right? Because you put yourself in that position, and it would normally just drive stress for an individual. But now that they have this backstop with Paytient, that reduces the stress. So if I'm old enough to remember the commercials done by a company called BASF, they were a chemical company, and their tagline was, "We don't make the paint you put on your walls, we make the paint you put on your walls better." Right? So think of Paytient as, we don't necessarily take care of everything with respect to healthcare in a high deductible health plan, but we reduce the stress that goes along with that move into a high deductible health plan that actually has broader implications later on down the road for the health of a population. So it does all of these things when they are introduced at the employee end user patient level. Some of them reduce risk, right? But some of them also reduce stress, which actually starts to reverse value proposition back to health overall. So as you manage finances at that employee end user patient level and help them manage their finances, you not only reduce stress, you engage people more, they stay at that employer longer, so they're in that health continuum. All the efforts that you put forth to manage the health of the population are amplified as a result of those things, and it has a reverse value proposition back to health overall.
Excellent. So we've talked about health, we've talked about professional development, we've talked about financial health. Mm-hmm. What other elements should we be thinking about in terms of improving engagement so that we can reduce risk for the company?
So the most traditional one of all is probably safety, right? You think about safety, and typically safety is thought of in pandemic-free surfaces and proper lifting techniques. Very, very important, right? As we talk about with deductibles and coinsurance and the right benefits plan, that's table stakes, it's block and tackle. What goes beyond that, right? So my property and casualty team members that I work very closely with, they set forth the right coverages for an employer with the right carrier, making sure claims will get paid at the right rate. We manage all of that process. They also consult to employers of, controlling active shooter situations, controlling cyber attacks, controlling all of these other things. Well, safety actually can have an impact on the rest of your team, right? Mm-hmm. If your team doesn't feel physically safe or doesn't feel safe in the environment of work, that has implications back to finance, implications to the professional, implications to the health overall. So pandemic-free services and proper lifting techniques are very, very important, but broaden that safety conversation to psychological safety.
So you've said a couple of times, and I think that I'm not following. You said pandemic-free services and proper lifting techniques. Can you expand on that a little bit? Like, proper lifting techniques, I get. What do you mean by pandemic-free services?
Well, so the pandemic kind of started this conversation. I had never used that expression before, I think. Pandemic-free services is making sure that when someone comes to work, they don't have to worry about catching it from someone else. Mm-hmm. That you've done the things in the work environment, the building you're in, the place where your people go every day to do their job, you've created a safe work environment. So think of a construction facility, maybe not pandemic-free services, but putting the right protections in the trench before someone actually walks into the trench, so no one gets hurt. Coning things off, making sure that as these heavy machinery are moving around, people aren't walking into that at the same time, right? An employer who doesn't have that traditional sense of safety and provide that for their team members has higher stressed employees. Those stressed employees tend not to be as acute thinkers at work, right? Because they're worried about getting hit by a piece of construction equipment. The ones who've done all that block and tackle really well have at least eliminated that aspect of the risk that's associated with how their team members interact. And their team members feel that their welfare is something that their employer's thinking about because they have provided cones and proper lifting techniques and the things to make them safe. It's the disengaged employees who can kind of walk off that reservation and create some issues. So beyond pandemic-free services, which is just kind of a avant-garde expression these
Right,
days,
right.
it's much broader than that, and I might be demeaning it a little bit by not
No,
giving it its due.
not at all. I think it's clever, and you're right. When we think about safety, we think about physical safety. We think about, I mean, obviously, we think of people wearing orange safety vests or having gates up so that the forklift has a place to drive back and forth. That's what I think of when I think of safety. But now that we're in a pandemic, we also have to think about providing a safe work environment so that people are safe from COVID or people are safe from another flu or even a cold or something like that that might be in the office. That's, I think, very critically important as well.
Yeah, and I think the other part of safety, which is what I'm seeing now, this conversation 4 or 5 years ago might be a little harder to have, but right now, as I mentioned earlier, the social construct between employer and employee is continuing to evolve faster, I think, now than it has in my career of the past 32 years. And as a result, that broadened conversation of psychological safety at the member level is something that employers should at least be aware of. And cognizant of, and so if the pandemic has created stress, and it has a tremendous amount in a lot of different areas, but just individual mental health stress, if you can do things as an employer to try to reduce that and make your team members feel safe, that has implications to all the other areas that you're touching.
Yes.
The John Muir quote.
We are wired to be on alert at all times. That is sort of the way human beings evolved and the way that we're set up. So we're always looking around out in the distance, looking for the threat that might be coming at us. And having that feeling of threat can manifest in lots of different ways. We can see it manifest in a physical sense, but we can also see it manifest in an emotional or psychological sense as well. So when you talk about safety, are you also thinking about psychological safety? Do you think about, the mental safety of being in an employer, and how does that look to you? Like, what does a psychologically safe place to work look like to you?
It's like you're reading my mind and you read my playbook, right? I mean, that's really a big part of the way we view this. There's a part of your brain called the amygdala, which is constantly on the search for danger, right? It helped us a lot through evolution, right? You wanted to know where the lions were so you didn't get eaten when you walked out of the brush.
Right.
Well, that didn't go away, right? I mean, we still have that, but the lions today are different than they were before, at least in modern society, right? So these are things that people are constantly on the search for danger. They need reassurance. They need to know that they are safe. And the implications of when you provide that are extraordinary. I've personally experienced it. The person I report to now has given me lots of latitude in that respect, and I have never felt as professionally fulfilled as I am now as a result of that. So I've personally experienced this and wish for others to feel the same. And I think it has extraordinary results, because when you create that psychological safety, lots of other problems go away, right? Culture in an organization tends to be amplified dramatically because people feel psychologically safe. It doesn't mean they run off the reservation. Most people who are feeling that way and are engaged and are fulfilled do the greatest work of their lives. I mean, you think about when you worked for an employer that was a micromanager that was asking for your TPS reports versus the one that provided you with autonomy, mastery, and purpose and the tools and resources to do your job. You know how you felt in both of those organizations, right, and you know your output in those organizations. So the need for psychological safety, while some may think is soft and not necessarily for the work environment, I would argue it's the exact opposite. I think it's the key ingredient. And part of that moves you from safety to the next aspect and the last element we can talk about, which is the social aspect.
I have one more question about safety.
Sure.
So I think about safety also in terms of how it fits in with diversity efforts and inclusion efforts, because working in a place where I can look around and I can see other people that are like me, whether they have the same skin color as me or the same orientation that I have, or just are similar to the way that I think, that makes me feel safer in an environment as well. Can you talk a little bit about how diversity and equity and inclusion efforts can improve psychological safety?
Yeah, and I think that's a great point. I'm sorry I didn't even touch on that. It's such a driver. If we're going to meet people where they are, we need to know where they've been. What's your history, right? I think it's Fred Rogers used to carry a note around in his wallet that said, "There's nobody in this world that you couldn't love if you just understood their story." I think it was something along those lines. I may be misquoting, but the general idea is understanding where someone has come from. The lens through which they see the world is extraordinarily important if you have any interest in fulfilling them professionally, providing them with psychological safety, providing them with a good path to health, making them economically viable, understanding the world with which they have seen, the experience with which they have seen the world and how they view that, and respecting that in your conversations, in your interactions, is extraordinarily important. If I'm the only person who looks like me inside an organization, I feel somewhat alienated if the others in the organization can't speak my language. That's a simple, easy way, right? There's a barrier. It's not going to work for me. If they simply don't understand the lens through which I see the world because of my personal experiences, then it's even harder for me. It's also hard for me to connect. And engagement is about connection. It's very important. Safety, connection doesn't occur unless safety is there. So understand diversity, being inclusive, recognizing that we all need to learn a little bit more about how others view the world. And that only broadens our intellectual capacity. It broadens our emotional capacity. It amplifies results. So I'm glad you brought that up, because it's a foundational part of providing psychological safety, is recognizing that every person has a different view of the world. And oftentimes diversity is not about skin color and not about race, creed, religion. Sometimes it's just about your personal experiences in the world and my personal experiences in the world. We look relatively alike. Mm-hmm. We're both middle-aged men. I'm a little older than you are, I'm sure, but we're both middle-aged
I don't think so.
White men.
Pretty sure you're younger.
But you also have a very different view of the world than I do, I'm sure, once we have a conversation and explore that. Respecting that is very important to creating that psychological safety. Maslow's hierarchy of needs at work is really, really important.
Yes, agreed. Chris, we've talked about the various ways that an employer can improve their performance and decrease risk by concentrating on an employee's health, by concentrating on professional development, on the financial well-being of their employees, and on safety. What's the final kind of bring it all together element that we're going to talk about today?
Well, so it's the social aspect of the connections in the work environment. But I do want to repeat, because I think it's very important, and it begs repeating, is where you start and where you end is going to be very different employer to employer, right? So this by no means is meant to be in some structured order. It's just recognizing that each of these things, like a Venn diagram, kind of overlaps.
Yes.
What you approach is going to depend on your audience. The social aspect is kind of the fun part, right? I mean, you've created an environment where people are healthy. Theoretically, you've created an environment where they are connected to the organization's goals and they see where they're going, they see where the organization is going. Those two things are married. They're financially viable, they're economically viable. They feel psychologically safe, physically safe, emotionally safe. You've recognized the diversity and inclusivity. And then the magical part is the social part, right? This is where people really start to connect at work. And one of the feelings you want to emanate is that, I have social bonds at work. I have people that I care about who care about me. We spend time together all, in work, and we work on projects together. We also spend time together outside of work. Mm-hmm. And we have trust and social bonds that are important. Humans want to be connected in many ways. I mean, loneliness is, and mental health right now is a serious epidemic. And it was in January 2020. It's gotten even worse during the pandemic. Loneliness is a big part of that. When you are socially connected, it not only is healthy for you, again, going back to all the, everything ties back to the other things that you're tugging on, right?
Right.
The social aspect is where I feel that's where your net promoter scores start to jump, right? And that's, in the end, you're doing all these things as an employer to drive shareholder value predominantly, right? And to make a difference in the industry that you're in, I hope. Right? Those socially connected folks, how they feel about each other is very tied to how the clients feel about the organization. You feel it, you sense it. The coffee shop, you walk in, you see the irreverent camaraderie, some of the chops busting that goes on behind the counter. Then they hand you your coffee and they're smiling at you, and it's authentic, it's real, and you connect to that. You want to go back to that organization. No different when you get on a 1-800 line and you're talking to an employee who's very engaged with their employer and socially connected and feeling safe and economically viable. They're doing a better job, and they're making that client feel better. there are social cues in organizations that you can see. One of the things I used to love prior to the pandemic in my own department was once in a while I'd see people with their feet up on their desk talking to someone else. And I've had others in the organization say, well, aren't you worried they're not getting the job done? And I'm like, look at our numbers. Our client lifetime value is off the charts. Our net promoter scores are the highest. Our top line revenue growth is there. And if I start telling Isaac to take his feet off the desk and get back to work, I've now created a psychological unsafe environment for him. He's doing the job. Let him do the job. If he needs to put his feet up for a moment, that's fine. Those are social cues that you see as an employer that tell you that you've got the right environment and the right culture there. And that is definitely felt by the clients. It's like a warm campfire that client wants to sit around as long as you'll have them, right?
Yes.
It's very important to provide that aspect. And it's very hard to provide that if you haven't provided safety, if people don't feel economically viable, if they're not otherwise healthy or on their way to health or maintaining their health, and if they're not connected to an organization that provides them with a sense of something greater than themselves and a future sense of belonging as a result. The social bonds tend to come from all of those other things. Again, everything is related to the next thing in some way, in some fashion, and it's unique in every single employer, and it's unique at every single employee. So the dynamic nature of this is, I think, a fun exploration to look at, but the social aspect, that's where the glue happens, and I think that's where much of that is seen by the outside, the external world, which is the client, and that's where you're really starting to drive shareholder value because people are connected to what they do, and the clients become connected to that. They feel it, like bees and dogs smell fear, they connect to that.
Jerry Maguire.
Yeah, exactly. The human head weighs 8 pounds.
That's right.
Random facts.
Yes, so that social dynamic, do you have a favorite technique for improving that? Just a fun thing that you recommend, or what have you seen on your teams that really helps to promote that kind of, like, are you a fan of retreats? Are you a fan of going bowling? What do you like to do with your teams that can really help improve that connectivity?
I think a lot of different things, and ultimately, organizations have done trust things where somebody falls backwards and you catch them.
Right.
There are a lot of different ways you can approach this. I honestly think retreats are part of it. We're trying to figure out as an organization specifically, and I think a lot of employers are challenged with this. Now with a work from home or a hybrid environment, it's very different than it was before. So the social interactions, you have to be more mindful and thoughtful about them. So one of the things we did when the pandemic first broke was the Benefits Advisory Board at IOA, there's 7 of us. We all took responsibility for 20 to 25 people in the department, and we would meet with them for 15 minutes on a weekly basis as a group. Mm-hmm. And we would play a simple game, name a movie or something like that, just to connect. Because we weren't in the office together. We were all working from home and trying to figure that out. We needed to figure out what's the cadence of connection. We don't want to have meetings just to have meetings.
Right.
We want to be authentic about it. Are we truly caring about each other? Are we having conversations about, hey, how are you actively and socially shutting yourself off from work when work is over and you're in your living room doing the work, right? For me, it was close the laptop, right? That for me was closing the door to work, and
yes.
then I'm home, and I felt home. Someone else told me that in the office, and I tried it, and it worked. Understanding the cadence of those social connections these days, I think it's harder. I've been in the work world for 35 years and, grew up through the 80s and 90s predominantly in the early 2000s where everything was fairly traditional in the office environment. Suit and tie, water cooler, your desk, someone else's desk. It's very different now. So how we connect there socially, I think we're still trying to figure that out. What is the best way to go? Number one, come at it authentically. Know that you don't, as the employer, you don't know everything, mm-hmm. and you need to have this open communication loop between you and your team. One of the things we've asked the team directly is, how often do you want to meet? I don't want my assumptions and biases to drive that process. I want the group to decide how often we meet. I just don't want anybody on the team to be lonely.
Yes.
I don't want them to be disincluded. So we have conversations actively about who are we seeing and who aren't we seeing, more importantly. Let's reach out to the ones we're not seeing because we don't want them to be disassociated or even to feel disconnected from the rest of the team. I think that's part of the social construct that is rapidly evolving. It's like, okay, what part of that aspect do I want my employer to take? Do I really want them in this world? And in the best possible scenario, I think people do want them in the world. They want the support. They want that social connection. But we need to figure that out as a society now, and as a workforce. We need to understand what those rhythms should be and those cadences should be as we create and continue to improve on those social bonds between the work folks that work together.
Excellent. So we've talked about these various, when we first started talking a little while ago, and we started talking about these elements, and I'm thinking of it in terms of, very discrete kind of buckets, these 5 things. We have the health bucket, the professional bucket, the financial well-being bucket, the safety bucket, the social bucket. And in the conversation that you and I have had here, I've started to reframe my understanding of this, that these are not separate, discrete buckets that I can go and say, well, today we're going to work on the financial well-being bucket. Instead, I think what you're teaching me here is that this is really a spectrum. These are guideposts that exist along a journey that we're taking. And when we're focused on one particular area, we have to realize that it's connected to all of the other areas. It's like a beautiful Venn diagram of 5 things that fit together and overlap each other in different ways. And I think that's a really interesting way of approaching things. Can you tell me a little more about that framework and kind of the conceptual model that you have in your mind? Are you going to write a book, maybe? And when you do, how are you going to approach this?
I might do a TED Talk, but I don't know about writing a book. I'm not Mark Twain, so, but I may give it a shot. I think recognizing that this is a very fluid thing at the employee level, at the employer level, and in today's environment, right? So it's highly dynamic. Where you lean in at any given time is going to be specific to that employer. But to your point, there's 2 aspects of this that I look at. One is the you said, you used the word silo, but I mean, in the healthcare silo, I need to be good at what I do. The block and tackle and table stakes of what's expected and what I'm doing, I need to be good. I need to engage patient. I need to engage the right TPA. I have to have the right network. All those things need to happen. But then it is, okay, what does it mean as this ecosystem starts to spill into other ecosystems, right? Mm-hmm. And the interrelativity of all of these things. If you think of this, take your average human resource director. Might be the most valuable person in any organization, truthfully. But we've put them in a position where they are managing an awful lot of transaction, and I think in many ways are challenged by that volume of transaction to manage strategically in ways that could support what we've talked about today. Take that HR director. They're managing a payroll relationship and a payroll vendor relationship and possibly some other things and aspects, offshoots of that. They have a benefits consultant, and then they have multiple carriers who have representatives as well. They have a retirement planning consultant and multiple vendors that are supporting that as well. They have a work comp consultant, possibly a property and casualty separate consultant. They have other aspects of HR and legal teams that they need to rely on. There's a thing called the Dunbar Theory, and it says that the human mind can only handle 150 relationships at any given time. You can just see professionally what that's like. Recognizing that if that person's responsibility is to professionally provide environments that professionally fulfill people, train the team members to be able to do that, manage all of those corporate relationships, trust that they are working for them, make sure that they're performing the scope of work and the service level agreements that they were meant to. You can see how they get pulled into transaction, and they're so busy moving from one transaction to the next that the overall picture and strategy of it, they just don't have the time as they could, right? And I think it's sad when I think about it that the way we've positioned them, what we put them in can be detrimental to the results overall. So think about it, right? IOA might be handling the benefits, but our competitors handling the property and casualty. And if we're having this whole health conversation between occupational health and workers' compensation and benefits, we're not sharing data. And so it's incumbent upon the HR director, the person in the organization responsible to understand, pull that data together, and then make sense of it. Very difficult to do when you have 2 competitors actually, and often through that whole spectrum, they overlap each other and they compete with each other in the market. So how does that manifest itself at the employer level? You can see how challenging that is. The big thing was people used to say, well, I don't want to put all my eggs in one basket. And I respect that, right? You don't want to go to one firm to handle everything for you, but what's the cost associated with that? Right. When you're now dealing with competitors who are maybe in some ways actively working against sharing that information that you really need. And as we move into an environment where data and access to information is really, really getting exploited more and more in possibly a very good way, particularly around healthcare, this is kind of a watershed moment where having access to that and starting to talk about what these things, the implications they have upon one another, and what that looks like. The current structure, traditionally, that we have that HR person in is going to be tough for that person to accomplish what I think they are capable of accomplishing, and taking that company to an entirely new level as a result.
We do lean on those people quite a bit.
We do.
And so hats off to them who are out there
absolutely
doing this work and just handling more and more and more things that we're handing them. I read an article yesterday that said now the HR person is also the school nurse because they're dealing with all of the pandemic related issues. This person has a positive test. What does that mean? When can they come back? This person is coughing. Should they get tested? Can they come in the office? We just ask so much of those HR professionals, and over time that is going to build up. We really have to take care of them and make sure that we're providing them with all of these same elements that we've been discussing for the last hour.
So is it a matter if you're going to disrupt the industry, or you're going to disrupt that environment by just resequencing the things you have, right? And understanding that there's an exponent value, as one has a value proposition, the other has a value proposition, but married together, at least insofar as you should marry them together for better results, there's an exponent value to that. It's 1 + 1 = 3 instead of 2. Recognizing that, seeing that, understanding some of the science behind it and some of the studies behind it as to why it makes sense to look at it, seeing that proximate cause, and trying to create environments that implicate better results, it's just a thought process. It's really changing the way you view this, resequencing it specific to that organization, and by extension, specific to that employee, end user, patient, can have pretty substantial results, and you haven't really had to invest in much except the way you view it and the way you execute.
So I've got a few questions that I just want to ask you just
Sure.
to get to know you a little bit more. So
Okay.
First of all, I know you're a sports fan, and I don't know if asking this question might be treading into an area where you might get in trouble or not, but the NFL playoffs just started. Who do you like to win the Super Bowl this year?
Oh, that's a great question. I mean, Dallas is looking tough, and I'm an NFC East guy. I'm a New York Giants fan. Sadly, this year was a tough year for us. I think Dallas is going to make some waves this year. I think they have a shot.
I think I heard you say Kansas City Chiefs. Is that right? Is that?
Yeah, potentially. I don't know. When my Giants aren't in it, I tend not to pay as much attention. I think Tampa Bay and Tom Brady. Just don't rule the guy out.
Yeah.
Even though the Giants beat him twice in the Super Bowl, don't rule that guy out.
As a Chiefs fan, Tom Brady has been my personal nemesis for about a decade. So I always keep an eye on Tom Brady.
He's an amazing story.
He really is.
From beginning to end, it's just an amazing story.
He doesn't stop. Is he ever going to stop? I think that he's
I'm sure he will. I'm sure he will at some point.
Maybe not.
Yeah.
The guy's a machine.
Yeah.
All right, you can be one animal for a day. What's your pick? Which animal would you like to be?
So my spirit animal?
Yeah.
Otter.
An otter?
Yeah.
Why an otter?
Tough, quick, familiar, yeah, a little cute. I'm not so cute, but I think all of the attributes, I connect to that. Otter, yeah.
All right, and then at Paytient we have one question which we ask everybody.
Oh boy.
It's our most important question of all, which is, what's your favorite ice cream flavor?
Ooh, chocolate.
Chocolate?
Straight up chocolate.
Do you have a particular brand or kind of chocolate?
I love Haagen-Dazs. Yeah.
Now, do you go for like the milk chocolate or the double Dutch chocolate?
No,
or like, which is
nothing exotic. Milk chocolate.
Just plain old milk chocolate.
Yeah. When I find something that works, I stay with it.
All right. Well, we'll keep that in mind. You'll be, getting your chocolate ice cream gift. I have no idea how we can accomplish that, but we'll figure out a way to send you some chocolate ice cream.
Okay. Not the healthiest of things.
Yeah,
the conversation.
Yeah, you gotta indulge from time to time. Give yourself a treat.
Mm-hmm.
So I want to tell you thank you. It's been super great to talk with you today. I really appreciate the time that you've given us. Your business sounds amazing. Here at IOA, you guys are doing such innovative and cool things. And really, the department that you're leading is top-notch and is one of the best in the country. So we are so thrilled to be able to sit down with you and take a few minutes of your time to ask you these questions and learn things. I've learned a lot today, and just really appreciate you and everything that you've done for us here today.
I appreciate the time, the opportunity to speak about this, because I think it's, in many ways, I think it's healthy for us as a society to talk about this and get it out there. I'm very excited about the future. I have always been. I'm a very positive person, but the opportunity to have a conversation and scale this conversation beyond the couch here at IOA is, I'm very grateful for. So
it's a nice couch, though.
It's not bad. Yes, the Johnny Carson
it's a good
couch.
one.
Yep.
Yeah. Well, great. Well, thank you so much.
Thank
we
you.
appreciate it.
It was my pleasure.
Thanks for joining me for my conversation with Chris Labrecque from the Insurance Office of America, IOA. I was really excited to talk to Chris today, and if you were too, continue to watch this space. We'll keep having other conversations with innovators and leaders that are leading this charge in the benefit world. Thanks a lot.